Only you two, you know.
I love you, Allison. That's my big sister.
And we're all laughing.
Thank you all for coming. I wanted to talk to you today about alternatives for chemotherapy. Chemotherapy is a treatment for cancer. The side effects affect your whole body. You lose your hair, you often get sick, you lose bodily functions, things like that with chemotherapy. Alternatives to this are a lot less with side effects and have better results. Some of the alternatives are radiation, surgery, and then there's also experimental drugs, experimental surgeries, and things like that. So chemotherapy is, in general terms, a treatment for cancer. So if you were more site-specific, like for breast cancer or for prostate cancer, where it's a specific area, you can go into more experimental surgeries and treatments, like radiation or a surgery or different types of drugs. I spoke with a radiation therapist, and he offered a lot of insight to some of these experimental treatments. Usually what happens is your doctor offers insight, and he offers the direction of treatment that you should go. So he usually will offer either like a combination of radiation with chemotherapy or chemotherapy with surgery. It all depends on where the cancer is in your body and what area it's obstructed. So today I wanted to talk to you about some of those alternatives, and to be more specific, I wanted to talk to you about radiation and a new experimental drug system that involves nanoparticles. So radiation, some of the positives of radiation is it's site-specific. So for breast cancer, radiation would focus right on the area of that breast cancer is affected. So it can go right to the area. So the side effects will be directed right to that area. So you'd have pain in your chest area over losing your hair or getting sick. So it's more site-specific, so it's actually a lot less invasive, and the outcome is usually a lot better than things like chemotherapy. Some of the negatives are it's hard to treat if it's spreading. So if it's spread throughout your body, radiation can't treat a larger area. And if cancer has entered your bloodstream at all, radiation cannot treat you. Radiation is known as one of the top 3 treatments: radiation, surgery, and chemotherapy. A more experimental surgery could be thermotherapy, which is heat therapy. There's cryotherapy, which is a cold sensor therapy. And then there's a new experimental drug delivery system that uses nanoparticles. And that system came from a chemical engineer at the California Institute of Technology, Mark Davis. He built the system because his wife was prescribed with breast cancer. This system involves a drug that is built from sugar particles, and it does not break down until it is put right onto the tumor. So you take the drug and it goes directly to the tumor and then breaks up the tumor. So it doesn't spread throughout your body, it just affects that one area. So again, some of the positives for that are the side effects are a lot less because it again focuses on just that area instead of the entire body like chemotherapy would. Some of the negatives though are it's still in the testing phase, so it still has a lot of work to be done, a lot of tests to be seen, see the outcomes, see what other side effects would come from it in the future. And it offers a lot of solutions to the location of the body. So you definitely will benefit from it if it passes all the testing phases. In conclusion, there are many treatments besides chemotherapy. The question though is is chemotherapy more effective to your whole body, and will it kill off the cancer better and keep it away better than going directly to a specific area that's site specific. There is no cure for cancer, so the question really is would you go for chemotherapy? Would you go for radiation? Would the combination together work better and possibly give you a cure to the disease? Thank you.